Today, let's talk about 8 signs of mini-stroke in elderly transient ischemic attack.
Did you know that mini-strokes are very common in the elderly, and that your loved one could be misdiagnosed if the symptoms are not recognized correctly?
According to the American Stroke Association, approximately 240,000 people experience a transient ischemic attack per year in the US. Also, nearly 1 in every 5 people who have a suspected mini-stroke will have a stroke within 90 days. Mini-strokes, or TIAs, transient ischemic attacks, are temporary blockages of blood flow to the brain. The clot usually dissolves on its own or gets dislodged, with symptoms typically lasting less than 5 minutes. However, it can be considered a warning stroke, signaling a potential major stroke in the near future. To better understand mini-strokes, let's first examine the 2 main types of strokes. Ischemic, blood clot. This is the most common type, affecting just under 90% of stroke patients. It occurs when a blood vessel is obstructed or blocked, preventing blood from reaching the brain. Hemorrhagic, bleed. This type affects just over 10% of stroke patients and is caused by the rupture of a blood vessel in the brain, leading to blood accumulation and compression of brain tissue. It is important to remember that a mini-stroke is a medical emergency and should not be overlooked. Major strokes and mini-strokes differ in several ways. While a major stroke can cause permanent disabilities, a mini-stroke typically causes only temporary side effects. Another key difference is the duration of symptoms. In a mini-stroke, they usually last for a few minutes, while in a major stroke, they can persist for up to 24 hours. However, the difference between a major stroke and a mini-stroke usually becomes apparent only after the event. It's important to be aware that these are not the only types of strokes. Silent strokes are also common, especially among the elderly. Silent strokes are so named because they often lack noticeable symptoms and do not cause immediate loss of function, leading many patients to remain unaware that they have occurred. This can happen because areas of the brain not affected by the stroke may compensate for those that are affected. The symptoms of a stroke vary depending on the affected area of the brain. To quickly recognize these symptoms and help your loved ones when necessary, ensure you watch our video until the end. Number 1. Dizziness or balance issues. Reduced blood supply to the back of the brain can lead to dizziness. This makes dizziness and balance issues some of the most common early symptoms of a mini-stroke. If you experience dizziness or vertigo without an apparent reason, it's important to contact your doctor immediately. 2. Numbness or drooping. The sudden and unexplained occurrence of numbness, weakness, or drooping in the face, arms, or legs is a distinct sign of a stroke. In a mini-stroke scenario, where the brain experiences a shortage of blood and oxygen, sensory processing can be impacted, affecting muscles, nerves, and skin. Since strokes typically affect one side of the brain, these symptoms often manifest on just one side of the body. This may result in an uneven grin, unusual facial movements during speech or eating, drooling, weakness in the arms or legs, difficulty lifting or moving limbs, loss of balance or coordination, and challenges in walking. 3. Difficulty speaking or seeing. Beyond the physically observable symptoms, strokes can also impact cognitive functions, particularly speech. When the brain's blood and oxygen supply is compromised, it can affect the muscles critical for speech, such as the tongue and lips. This may result in disrupted speech patterns due to interruptions in the neural signals that control speech functions. Common speech complications associated with strokes include dysarthria, characterized by unclear speech due to slow, indistinct, or incomprehensible articulation, often as an early symptom of a significant stroke. Aphasia involves difficulties in language processing and comprehension, leading to the use of nonsensical language, invented words, or an inability to communicate effectively. Apraxia presents more physical challenges, particularly affecting the muscles of the tongue and lips, thereby impacting proper speech articulation. Additionally, strokes can lead to vision impairment. Individuals may experience difficulties with object recognition, facial recognition, and visual spatial awareness due to the stroke's impact on the visual processing areas of the brain. 4. Inability to concentrate. Some patients experience difficulty concentrating following a mini-stroke. This issue arises due to the brain's reduced supply of oxygen and nutrients, which can affect normal brain function. Consequently, this impairment may influence concentration abilities and overall brain health. 5. Confusion. Patients who have experienced a mini-stroke may exhibit signs of disorientation, frustration, or confusion. They might have trouble recognizing their own identity, their location, or even the current day. Prompt treatment is crucial, as it can reverse these symptoms if administered immediately. However, if left unaddressed for an extended period, initial confusion could escalate into more severe cognitive issues, including significant memory loss and dementia. The onset of stroke-induced confusion can be abrupt, often interrupting ongoing activities and leaving the individual unable to think clearly, speak, or understand spoken information. Before we continue, we invite you to like this video, subscribe to our channel, and turn on notifications so you don't miss out on any of our health tips and informative videos. 6. Severe headache. Intense headaches can be a common symptom during a mini-stroke. Distinguishing these headaches from migraines can be challenging, as they may last for hours or even days. If you experience a headache that is unusual for you and persists for more than 4 hours, it is advisable to seek medical advice promptly. A stroke-related headache is characterized by sudden and severe pain, distinguishing it from a migraine, which typically starts as a throbbing discomfort. Migraines often worsen progressively and may be accompanied by other symptoms like tingling skin and visual auras. 7. Syncope, or fainting. Syncope, characterized by an abrupt loss of consciousness and muscle control, typically lasts under 5 minutes. It is caused by a temporary disruption in the brain's blood supply. While consciousness may be regained spontaneously, some cases require urgent medical intervention. A serious fainting episode, especially if accompanied by additional symptoms like confusion or weakness, warrants prompt evaluation by a medical professional. 8. Hallucinations. Some people may experience hallucinations as a result of a mini-stroke. This is partly because ischemic attacks can increase the risk of vascular dementia. It's important to remember that the symptoms of a mini-stroke typically last only a few minutes. Additionally, it's beneficial to be aware of 3 lifestyle factors that may contribute to the occurrence of a mini-stroke in the elderly, which we will discuss next. Poor nutrition can increase the risk of a future mini-stroke. Therefore, it's important to maintain a balanced diet and control blood pressure. Additionally, a sedentary lifestyle has been linked to mini-strokes, making regular exercise crucial for improving cardiovascular health and blood flow. Lastly, the inability to manage stress effectively is another risk factor. High levels of stress can elevate blood pressure and increase the risk of stroke. How to identify mini-strokes? Remember to act fast when experiencing signs of mini-strokes. The National Stroke Association recommends using the FAST acronym as a guide for identifying warning signs and knowing what to do. F is for face. Ask the person to smile. If one side of the face droops, it's a warning sign. A is for arms. Have the person lift both arms. If one arm drifts downward or is difficult to move, this is a warning sign. S is for speech. Request the individual to repeat a simple sentence. If their speech is slurred or sounds unusual, it indicates a warning sign. T is for time. If any of these warning signs are present, it's critical to call 911 immediately and get the person evaluated at a hospital emergency department for a possible stroke or mini-stroke. How do you know if you have had a mini-stroke? Let's discuss how to determine if you've experienced a mini-stroke. Although mini-strokes may not cause permanent damage at the time they occur, seeking medical attention is crucial, regardless of the severity of symptoms. To identify the possible cause of a mini-stroke, medical professionals often perform diagnostic tests such as computed tomography or magnetic resonance imaging scans of the brain and carotid arteries. Here are some of the risk factors of mini-strokes for the elderly: hypertension, high cholesterol,
obesity, smoking, diabetes, and an inactive lifestyle. Like most other diseases, the risk of mini-strokes increases with age. However, these risk factors are often manageable, providing opportunities for prevention and improved health outcomes. How to prevent mini-strokes? There are several strategies to prevent a mini-stroke, as recommended by the CDC, Centers for Disease Control and Prevention. These include controlling and treating high blood pressure, managing cholesterol levels, avoiding smoking, and the regular use of aspirin under medical guidance. It's important to note, however, that aspirin should not be used to treat an active stroke. Instead, if you or a loved one experience a mini-stroke, it is critical to seek immediate medical help and go to a hospital. A patient's overall health condition often plays a crucial role in their recovery. Generally, the better your health, the more favorable your recovery prospects. For ischemic mini-strokes, patients may be given medication to dissolve the blood clot or to remove the blockage that is obstructing blood flow. As we age, health risks, including the risk of stroke, tend to increase significantly. However, with proper care, including balance exercises for seniors and attentive health management, you can take important steps toward maintaining your well-being and achieving peace of mind. Remember to contact your doctor if you experience any stroke symptoms. In such situations, the most crucial action is to seek medical help as quickly as possible. If you enjoyed this video, please give it a thumbs up. Remember to share it with your loved ones so they also will know the 8 signs of mini-stroke that cannot be ignored. Also, subscribe to support our growth and hit the notification bell so you don't miss out on our next video. Now, we're curious to know, did you know about these signs of a mini-stroke? Share with us in the comments below. Before you leave, you may also find some other helpful videos popping up on your screen right now. Feel free to click on any of them, or even better, watch both to continue your knowledge journey with us. Thank you so much for watching. See you in the next video. Bye.